Thank you, Professor Horman, for giving me the opportunity to present the Determine project, which is not actually what the EU is doing on this topic, but is one project within the EU. Determine is a consortium for action on the social determinants of health, and it runs from 2007 to 2010. Contract holder of this project is the National Institute for Public Health in Czech Republic, and the work is coordinated by EuroHealthNet, which, as a network of health promotion and public health agencies in Europe, is engaged in a variety of projects and work to identify and explore strategies and impact of health promotion for greater health equity between and within European countries since almost 10 years now. From the beginning of this engagement, the Federal Center of Health Education, who is disseminating the results of this project, is actively involved in this project as well. And we have been able to also incorporate the experience from the National Cooperation Network, Health Promotion for Socially Disadvantaged, in this project. The project brings together 50 health bodies, public health and health promotion institutes, governments and various non-governmental, professional and academic organizations, and networks from over 26 European countries. 30 of them are main partners coming from 21 European member states. We have also incorporated partners like WHO, OECD, and ministries from different European countries. The aim of the project is, on the one side, to take forward existing work on the socio-economic determinants of health as an approach to reduce health inequalities in the EU. We therefore built on the work of the EU project Closing the Gap, which was running from 2004 to 2007, and which has developed a European knowledge base and infrastructure to exchange on, and to implement and strengthen strategies and actions to reduce health inequalities at different levels. Determine also tries to complement the work of the WHO Commission on Social Determinants of Health. The second aim of the project is to make concrete progress towards policy developments that positively influence the social determinants of health. We're trying to do this by contributing to the current knowledge base on health in our policies approach, identifying innovative approaches, raising awareness of social determinants of health in other policy sectors, and building the capacity of consortium members to act upon them, and to develop the web portal health-inequalities.eu as a main EU online resource for social determinants of health and health inequalities. Within the first year of the project, we have identified and explored examples of policies and actions addressing the social determinants of health inequalities. This has been done at both member states and EU level. We have therefore given questionnaires to 12 partner countries, and conclusions from those answers that can be drawn are that there is no real comprehensive systematic addressing of social determinants of health inequalities in the partner countries. But there are many actions and policies referring to social determinants of health, not only in the health sector, but also in other policy areas. Where high-level cross-governmental strategies are applied, this stimulates action to reduce health inequalities. Mechanisms in use to facilitate the work on social determinants of health are, for example, intersectoral committees, health or equity impact assessment, and consultation processes across sectors that may also contain horizontal and vertical consultation processes. On the EU level, actions like the open method of coordination encourages countries to establish objectives and to develop integrated policy goals in the area of social protection. In a second step, determined partners are now investigating examples of economic evaluations which have been conducted on policies and strategies relating to social determinants of health inequalities. This is done to find additional arguments for why health should be considered in economic terms and to strengthen the economic case for health in all policies approaches. Results so far show that there are not many examples where health outcomes in general or different health outcomes for different groups were considered in the measurement of costs and benefits. Where economic evaluation is done, it is done on relatively low levels. Examples of economic evaluation are found in those countries which are already focusing on social determinants of health or health inequalities. One problem of this economic evaluation is the complexity of undertaking them. This refers on one side to the lack of trained personnel that leads to limited capacity to undertake such evaluations, and on the other side to the fact that health effects and distributional health effects are complicated to measure and that there are limitations regarding what factors are possible to measure. Having focused on the macro-scale intervention so far, I'd like to present you as well our work on the micro-scale, for which we have chosen 3 pilot projects to showcase innovative methods of how to address socio-economic determinants of health. The projects had to be innovative in terms of representing a new process for achieving behavior change, involving new people in the working partnership, or seeking to address new or innovative target groups. The three projects we have selected are a project in Denmark that aims to improve health behavior among obese men with little or no education, involving, for example, as well employees or fast food suppliers. A project in Hungary that aims to raise awareness for planning healthy and sustainable houses amongst a segregated Roma community. And a project addressing health determinants for homeless people in Slovenia. We are also supporting a fourth initiative on social tourism in Belgium. The 3 selected pilot projects receive funding that is used to adapt particular elements to better address socio-economic determinants of health. And the projects run for a year from October 2008 to October 2009, and they will be evaluated to look at where and how approaches have been successful and to identify areas where learning can be transferred across a wider EU level. Another part of the projects are policymakers' consultations. We have, or determined partners have, interviewed 40 non-health sector policymakers with the aim to explore their experience and capacity of intersectoral cooperation, their awareness of equity, health and health inequalities, their readiness to address social determinants of health inequalities, and their need for information and support tools for successful cooperation to address the social economic determinants of health. The most general result we can take from these interviews is that all interviewed policymakers stated that they do engage with other sectors by some means or others, but health or health inequalities are usually not the entry point for the cooperation. When inequalities are considered, they are not understood as a gradient that runs across society. Activities focus usually on low socioeconomic status by addressing vulnerable or marginalized groups. The goal of attaining equity for all appears to be a sensitive issue in some countries, as political ideology does have a bearing on whether action on socioeconomic determinants of health is considered a responsibility of government or not. Policymakers more readily acknowledge ways of impacting on the socioeconomic determinants of health where this have a direct physical relation to human health. In the context of policies which aim to improving the physical environment in which human beings live, and which therefore link to human health is easier to establish. Socioeconomic determinants are more easily introduced into the policy discourse. Activities to improve health and reduce health inequalities are still mainly emphasizing on changing lifestyles and behavior rather than focusing on underlying structural determinants of health inequalities. So what can we learn so far from our results for the role of the health sector should try to take in this process? The health sector has a central role to play when facilitating joint action on the socio-economic determinants of health inequalities. And in order to unlock its leadership potential, the health sector needs to strengthen its role, providing concrete support to other sectors when they request it, but also take a more proactive role and actively invite other partners to the discussion table to help define both the problem and the strategy. The health sector needs to better clarify and communicate to its partners the unique contribution and added value of a public health or health promotion strategy on the socio-economic determinants of health inequalities. This includes creating a common language to be understood by other sectors. Health professionals should be encouraged to listen to other sectors in order to understand their policies and their policy entry points, and engage them in sustainable partnerships by identifying win-win solutions. And networking, of course, as always, a different issue. Determined partners have now started to take forward all these results and recommendations we have found so far, to start capacity building and awareness raising activities, to be able to develop and to initiate successful cross-sectoral health equity strategies, and to improve understanding of and work with other sectors. These activities will be running over the course of the next year, and we are just going to start them up on a big meeting next week in Prague. And if you'd like to know more about the process of these activities and the project, I'd like to invite you to visit our portal, which you can find at health-inequalities.eu, and where you can follow the process and capacity building and awareness raising projects. And you can also find information on national level policies concerning social determinants of health, strategies undertaken in other countries. And you can also search for good practice. We have a good practice directory on the portal as well. And of course you can find the reports and preliminary results of the project so far. And of course all the results which are coming out of the next year will be presented there as well. I also like to invite you to come to our information stall we just have outside of the conference room, if you not have done so far. And my colleagues and I will be happy to discuss you further on the project. So thank you very much.